All right.
Dr. Inglewood, when you get a moment, I would like to speak with both you and Kelly in my office today.
Okay, give me about 5 minutes to finish up this note.
Thank you, Doctor. I just saw Kelly down the hall. I'll go and grab her. This should only take a moment.
Well, I hope so. I have so many patients that I have to get through today still.
Okay, no problem. Please come in and sit down so we can get started.
Yeah, what's this all about? I have to get back to my patients. I still want to fit 10 more in.
Well, both you and Kelly have placed complaints about the patient load. Dr. Inglewood, you complain that Kelly spends too much time with her patients.
She does. I have to do all the work.
Excuse me, let me finish. Kelly complains that you rush through your patients so fast that you neglect to provide the necessary education to patients and family that is needed, and you order antibiotics that are not needed. Is this true?
Well, I have to meet my quota, and sometimes you have to do what you have to do to get parents off your back. Are you really complaining about me doing more than what is needed for my patients? I think that is going above and beyond the call of duty. Antibiotics won't hurt.
Actually, I disagree with that statement. Ordering antibiotics when they are not necessarily certainly does harm them. Overuse and improper use of antibiotics is a major cause of resistant bugs. Also, I feel that it is unethical to care more about meeting the quota than you do about spending the necessary time needed to ensure appropriate care for your patients. Education is very important. What is the point in treating people for their diseases if you're not going to educate them on how to maintain the level of stability that you accomplished here in the hospital? They are just going to go home, get sick, and come right back. Remember what we are here for. Also remember the ethical principle of beneficence. Do no harm. I do not feel that spend too much time with my patients. I spend the necessary time needed with my patients to ensure good quality of care and safe outcomes.
But we are given a quota.
You know, I really try to use evidence-based practice in my practice, and I have been using the clinical guidelines for up to date. It is really nice because it outlines clinical predictors of disease, who should be tested, what tests should be performed, and how management should be approached based on the evidence. I really think that these guidelines can be of use to you. For example, one of the most common complaints is pharyngitis in both adults and children, and up to date provides clinical guidelines for treatment that are easy to follow.
Well, I suppose I can take a look at it, all of this evidence-based practice, but it doesn't solve the issue of us being given a quota.
No, you're given a bonus for working hard. If you manage to see more patients than average, we believe you deserve a reward. However, it is not an incentive to see as many patients as you can without regard to the quality of care you are providing. We want you to provide the same care that you have prior to this bonus, and if this average care is being provided and you so happen to see more patients, then that is fine. It is not ethically and morally acceptable to compromise care for the sake of monetary gain.
Well, when you say it that way, I guess you're right. I do want to practice safely. I will slow down. I'll spend more necessary time providing education. When I'm pressured to prescribe unnecessary or antibiotics or other treatments for that matter, I will take the time to explain why I will not order something and the consequences of adding non-beneficial treatments to the care.
Thank you, Dr. Inglewood. I appreciate your willingness to work with us on this matter. This has been a productive meeting. Kelly, are you
Somewhat.
somewhat? Dr. Inglewood has agreed to spend more time with the patients and stop ordering unnecessary treatments. What else is the matter?
Well, I'm just somewhat bothered by the fact that only physicians are offered bonuses for working hard. I work just as hard, and I really do feel that there's an unfairness happening. I do not feel as valued as the physicians. I sort of feel unappreciated. I don't think it is ethical for us to be treated differently. I provide good quality care every time for every patient without receiving a bonus for doing so. But she does. I really should have negotiated the bonus in my contract, but I was afraid that if I asked, I might affect whether or not I got hired.
Well, Kelly, that has not been brought to my attention before. I just didn't think about it. But I want you to know that you provide excellent care to our patients here and they love you. I hear nothing but good reviews. I do not want your hard work to be overlooked, and we do value you and what you do. I know Dr. Inglewood is busy, so we can let her go. But why don't you hang out a bit if you have time, and we can discuss a bonus rate for nurse practitioners.
Thank you. I would like that.